Welcome everyone. My name is Becky Sanders. I'm the Program Director for the Upper Midwest Telehealth Resource Center. And today we're going to be learning about the opportunity for the United States Department of Agriculture Distance Learning and Telemedicine Grant. And at this point, I'm going to go ahead and hand everything over to Casey.
Thank you, Becky. And hello everyone. It's great to be speaking with you all today. Hope you can hear me well. And as Becky indicated, we'll be talking about the Distance Learning and Telemedicine Grant, but not just the grant itself, what you can be doing with it to fund distance learning and telemedicine in your region, for your service areas, and for your patients and your providers and everyone that's intertwined. And why this is actually a grant that, as Becky indicated, is very difficult, but has gotten a little bit easier to apply for in recent years. And additionally, the competitive level of this grant is going to take a bit of a nosedive, and that's good news for everybody. It's one of the reasons why we're doing this webinar today. We had additionally planned on doing a on-site workshop in the area. We didn't get enough folks signed up for that, unfortunately, but my teammates and I are traveling around the country delivering on-site 5-hour workshops of deep dive how to do this grant from beginning to end. And what makes us qualified to do so, I think, is that we've been working on this grant program since 2002 and providing assistance to folks that need this type of funding, and at a very high success rate. And last year was the first year ever that we ended up getting all the ones that we knew of that had applied for, that we helped assist with, funded, every single one, 100% hit rate. Normally we have about an 80 to 90% hit rate, which is still phenomenal. But this is by far the first year we got them all. And the reason for that is there's so much funding for this grant right now. This is a program that usually has about 20 to 30 million in the pot. Last year there was about 45 million, and they funded, as far as we know, they funded almost every single application. This year they've got in excess of 65 million is what we're hearing. And it's at the point now where a grant that used to be very competitive and hard to apply for is now funding almost every application that's eligible. And they've whacked the match down quite a bit. If you are familiar with this grant from years past, then you're going to learn a lot about the changes that have happened here today. But we want to create excitement around this program because of the amount of funding, and empower you all through this webinar and through these workshops that we're doing to go after this grant, because the folks that are the most eligible and that this grant really caters to are the poor and the rural. And they're usually the least equipped to write this grant and go after it. So with our help, we've had so many organizations basically said, you know what, we couldn't do it without you, but we did it. And we got our grant, and now we can, implement our program. And we can talk about how we can work with folks in different ways. But just as an overarching idea here today, this is the time, if you're looking for telemedicine funding or even distance learning funding around some of your telemedicine components, this is a great time to apply for this grant. So I'll go ahead and dive right in. Let's take it to the next slide. All right, so before we begin, a little mental checklist for you all. Forget everything you know about federal grants, okay? Never assume with this program that something that you're used to with other federal grants is exactly the same. There are obviously some similarities, but this grant is a different beast, and every experienced grant writer that I've worked with that has taken on a DLT for the first time, they agree. So you just have to be careful with definitions of terms, and never try to apply logic, because there's always some specific thing that they're looking for here, and we can help you understand what that is. When in doubt, refer to the recent year's application guide. So last year, for instance, FY19 was the last program. The FY20 program is expected to open soon, but the deadline has not been set yet. So everybody is still ahead of the curve. But because of the big changes in FY18, we don't expect big ones again. So people are just kind of using FY19 guidance and starting the process to get things underway, because there are a lot of components to this grant. You don't want to wait until the grant has been announced to start. If you do, you'll just be a little bit, up against the gun. It's not to say that you can't complete it in that time frame, but knowing what we know about this and helping you guys workflow the process effectively on the front end, there's no reason not to do it early and get your grant submitted early as well. And that's the final point on here is just really start the process now in terms of having internal discussions or engaging, with vendors to get pricing on ideas that you've already got. So what is this program all about? And it started, we've been working on it since about 2002, but it started in the early 90s and it's been around ever since. And it's a premier source of funding for telemed and distance learning equipment for rural outreach projects. And the whole focus is to bridge the digital divide. You guys have heard that a lot, and that's their motto with this grant essentially, between urban and the areas that have plenty of resources with the rural, that are isolated geographically, that have fewer resources, that deal with all the issues of like outward migration and everything. Now, when this grant came out, the rural issues that exist today are still very much in play, except for a couple of things. The technology has come down in pricing, and some of the other things that have happened to make this more available as well. Looking at some of the DLT basics, we've got the CFDA number, which is 10.855, in case you're looking for that number. The due date is typically a spring application. So we heard this year that, really last year, they were trying to open up in December for the FY20 program. That luckily didn't happen. So again, we have more time to do this grant, but we do expect it to open soon. However, it is a moving window every year. It could delay a little bit longer, or it could come out this week. It's really anybody's guess. It's rumored to have 80 million. I've heard 65 million, but I think they're going to roll over some funding from last year, because what happens is with grants that get awarded, some people rescind their funds and that'll roll over to the next year. So I think we'll see an expanded pot of money. As far as the matching funds, this is another reason, from the previous slide, why this program is becoming a little bit more eligible and easy for rural sites to go after. I didn't want to get too ahead of myself. Is the 15% federal request match. Now, this has dropped dramatically from in the past. If you have written this grant before, you would have noticed that they did have an eligible minimum component of 15%, but there was a scoring component tied to match for this grant. So you'd get 0 points for that. Every grant I ever worked on with this matched at least the 30 or 50% level, in some cases 75% or even 100%. Especially in the Midwest, where you guys are from, where NSLP numbers and economic need isn't usually as high in the rural areas as it may be in other states, at least as an average. So that really put a huge damper, if you will, on folks going after this grant in the past. But now it's just a flat 15%. The award size is up to $500,000 at the moment. We are hearing that they may increase the award size to facilitate, more giving with this program. But on a $500,000 request, the maximum match now is $75,000, giving you a total project budget of $575,000. So again, that really has come down in a big way in the past and made this grant a lot more feasible for many, many applicants. In the past, there's also been special consideration points, and this varies by year, but in FY 18 and 19, they had prioritized STEM and opioid abuse treatment type projects, and they awarded up to 10 points for those. We'll discuss this component in detail a little bit later. We're hearing that these priorities will probably stay intact, but just be willing to adjust your project design in some way to try and vie for these points if things do change when the guidance comes out. And as far as submission, they do still allow hard copies, but they started allowing grants.gov submissions a few years ago, and that's the way you want to go unless you're up against a really tough spot and have to submit a hard copy, and there's some reasons for that. But you should really try and apply via grants.gov. And the first step in the process, once you decide to do this grant, is really looking at your grants.gov and SAM registrations and making sure everything is good there. So let's cut to the chase and talk about eligible expenditures and ineligible expenditures, and then I'll stop and see if there's any questions so far that are relevant in the chat. Otherwise, I'll just keep going. And as Becky mentioned, we'll stop at the end and have more of a live Q&A discussion if folks on the line want to talk about what they're doing and get some feedback. There will be some time to do that too. But for now, eligible expenditures. this has always been a capital expenditure type of grant. So the main thing they're looking at is like interactive distance learning, telemedicine equipment, the infrastructure to support it, as well as ancillary core devices like software licensing, internal wiring, switches, routers, things of that nature. Anything that is digitally connected and a peripheral to devices are also usually eligible, like scopes, computers, things of that nature. What has been added to this grant in the past, which was really a big change, was up to 20% of the budget can be spent on broadband related expenditures. Now, our understanding of that, and it's very specific, it's just for last mile projects. This grant still does not cover bandwidth or recurring costs or anything like that, but the broadband related expenditures, I believe, have everything to do with last mile projects. So if you're doing a $500,000 grant, up to 100,000 could be put towards that. For any sites that may be lacking that broadband connectivity, but are very close to having access to it. Finally, cloud services. This grant has warmed up, and we've actually done a lot to help educate the RUS administration on cloud services, not just us, but a lot of other, I think the industry, I should say, to help them understand that this is kind of where things are going. There's always a need for hardware, and then there's a need for cloud in some cases. So they're now open to funding cloud services if adequately defined and justified. And then ineligible expenditures are really everything else. The grant covers the equipment, hardware, software. It does cover installation, 3-year maintenance agreements, plus shipping and taxes if you're not tax exempt. But everything else is essentially ineligible. Any type of recurring expense, administration, salaries, and benefits aren't covered by this grant. No personnel, no indirect cost rate, and there's no evaluation costs. But at the same time, there's no evaluation component. And because they don't fund you for that personnel, when it comes to reporting on this grant, things are fairly laid back, except for, when it comes to what you bought and where you put it. They want that nailed down perfectly. And then there's also unrelated technology purposes that aren't qualified. So if you try to use something, a piece of equipment that's eligible, but for a non-distance learning or telemedicine purpose, then it would be, deemed ineligible. Okay, so Shannon, if you're on the line, do you see any relevant questions about the grant programs that's been covered so far? If not, I'll continue to move on.
Sorry, Casey. Yes, I think I'm unmuted now. No, I do not see any questions.
Okay, we'll carry on, folks. And just remember, if you do have a question, just put it in the chat, or you can just keep it till later. It's fine. So who can apply? There's really 4 levels of eligibility, but the first one, organizational eligibility, pretty much assure anybody on this line is going to be eligible. It's easier to define who's not eligible, and that would be like individual sole proprietorships and federal agencies. Even private for-profit companies can apply for this grant and get funded as long as they're doing rural telemedicine or distance learning. So this is wide open. Programmatic, now the fiscal agent, the applicant does have to have the DUNS and SAM registration, which I mentioned earlier, as well as grants.gov. So that's very important. Secondly, there's programmatic eligibility, which is how you plan to use the equipment. And we've seen people go after this funding, but they're not, using it for the right reasons. And so their whole project gets denied. We'll help ensure that does not happen to you guys if you're looking to work with us too, or looking for our support in any way. The third level of eligibility is a component called rurality, which is based on town population. We'll do a deeper dive into this a little bit later, but overall, the project rurality score has to have at least 20 points. So that's the third layer of eligibility. And the fourth is match. And if you incorrectly do that calculation, you end up at 14.99%, or your match letter is not correct. And there's several details that make a match letter valid. They will cut the match, and that will, get your grant kicked out of the process. So it's very important, that the match is in place. Okay, so let's talk about types of projects, because you know a little bit about the grant. And really all the funding and equipment in the world isn't going to solve your problems. It's the plan, what you plan to do with it. And the plan usually comes from an established need that you guys already have in mind. And if you're not sure what those needs are, we recommend doing needs assessments, which is what we'll talk about. I'm going to go ahead and populate this whole slide and just kind of go through some examples here. We've seen the whole gambit of partnership and use of this equipment over the years, from school to school, school to health center, to do things like school-based health, prevention and wellness, mental health and substance abuse programming. This is gaining massive momentum in a lot of states, delivering healthcare directly into the schools where students, spend most of their time, and for good reason. And it's shown to be a very effective service delivery model once things are up and running. We've seen school to higher ed for dual enrollment and teacher training, higher ed to higher ed for teaching satellite campuses. We see libraries and community centers get involved a lot, especially when folks are trying to connect to an area that doesn't really have any other source of or a facility for connectivity, but also just for general public education programs, which don't have to be done all that often, but you can do virtual webinars and presentations out to these libraries and community centers that really help disseminate information to the public. We've seen medical centers to clinics, so the big med centers providing specialty care or just filling in the gaps for these clinics that are lacking certain services. We've seen clinic to clinic or hospital to hospital, whether that's sharing doctors or sharing CME and wellness and prevention programs, or looking to develop a comprehensive care program. And then mental health and substance abuse clinics to anyone. This is also just, mental health over video has always been a big application, but with the advancement of reimbursement policies and people getting paid, telehealth is really starting to take off in a much bigger way now. And mental health is a huge priority across the board. And we're trying to help open mental health agencies' minds in terms of also connecting with law enforcement, connecting with other agencies in the area for training, if they're not already doing that, which a lot of them already are. But mental health straight into the schools for behavioral, health and early detection and intervention. Huge need in rural areas. It cannot be understated. And then state and local orgs. We've seen state departments get involved, state departments of corrections. If you guys have any desire to connect out to, jails and provide services, that's totally fundable, by this grant. And I'd actually want to just bend the air. We've got, and I'll describe this later on and give you our contact information. For the area that Upper Midwest TRC supports, I support the states of Indiana and Iowa. And I also have Shannon Schaefer on the line with me, my teammate, who supports the states of Kentucky and Ohio. And they've been very busy with telehealth projects. I just wanted to give her a minute to kind of share an overview of some recent, success in her area. Shannon?
Thanks, Casey. Yes, so we, it's always amazing to me when you connect with organizations, because there are so many projects, obviously, as you can see from the slide, that are outside of the box or outside the realm, I think, of what people think of for traditional telemedicine or distance learning. In Kentucky, one of the big areas we've seen for projects that, we've worked with several organizations that have been funded for multiple years back to back, who have used those funds to build very, very strong behavioral health telemedicine projects. And because behavioral health is such a problem in the rural areas, because the recruiter or the providers are just not available, it's just not possible to recruit the providers or enough providers to cover those areas. And so oftentimes individuals will either have to be transported, depending on what their situation is, transported to a site, or again, if it's an individual, there are all types of barriers, of course, to seeking care, and then consistent care, which is so important with behavioral health. So we've seen, there's a hospital system that we've worked with that has worked, they are currently working with several group homes where they are providing behavioral health in the home, which again is saving the staff from having to take 2 individuals to transport 1 person to the site. Also, the frequency of appointments is much greater because, again, it's something that they can do right there on site. And what they found too is that the population that they're working with in the group homes are much more receptive actually to the telemedicine concept, because I think it's, you know, it's very much a virtual world. And so for them being able to see the provider face to face and make that connection, you know, they have that I guess recognition, but they're also more apt to be open, I think is the feedback that we've received, and share their story. So that's been a great, I think, point of success. And then distance learning, there are, again, several organizations that we work with who, because they're in such rural areas, they're not able to recruit, for instance, a foreign language instructor. And in many states, you know, a foreign language is required for high school graduation. So they've been able to connect with community colleges to provide the foreign language instruction. Or even in one case, there was another high school that could provide that instruction. So again, you know, absolutely think outside the box, but depending on, you know, what your individual need is. I think the other important thing to stress too is once you have kind of that project that you want to get up and running, you know, once you have the equipment, you can continue to build on this. And it is, again, you know, a project that you can apply for year after year and continue to build those sites.
Excellent. Thanks, Shannon. I really appreciate that. And again, our whole goal is to help folks increase competitiveness of their ability to get this grant by giving feedback on scoring and things like that. And that's becoming less of a concern these days, but twofold. Our focus is helping you develop your needs and looking at this grant on a very broad scale. A lot of folks come to us with one idea, and that's great. It usually helps get things going, and sometimes that's all that is needed to be done. But when we start to engage other groups within the organization, other leads of departments and things like that, we come to find out that there's a bigger need across the board. And in installing this equipment for just one purpose, it may be very worthy, but if that one purpose goes away, then you've got equipment just sitting there, and nobody wants that happening, right? So if you can find multiple uses for the equipment, you know, and scale that across your organization, that's really what we're trying to help you guys envision. If you have multiple sites, you know, how do you bring this all together? Let me go to the next slide, and we'll talk about some of the major grant components. So you can know what the scoring is all about and some of the non-scoring sections. So starting on the left, the objective scoring are points that you can pretty much control going into the review process. Rurality is the first score. And that has to do with your site list, your end users, who you're sending content to, or who's receiving, you know, services. And that scores up to 40 points. And remember, you have to have a minimum of 20 there. But and then economic need is up to 30 points. They use a factor called SAPE, Small Area Income Poverty Estimates, on a county-wide basis, which isn't great, but it's just the way they do it. Maximum of 30 points, no minimum required. And then the special consideration up to 10 points. Since they added special consideration, we haven't seen the way that they've scored this. So we don't know if it's just a flat 10 and that's you either get it or you don't, or if they give you up to 10. So we just say up to 10, but we really don't know how that scoring component is administered. Again, in the last few years, scoring really hasn't mattered, but just, you know, keep that in mind. In the next column, subjective scoring, the only scored narrative section of this grant now is the needs and benefits, and it's down to 30 points. In the past, they also had cost effectiveness and innovativeness, two very annoying parts of the grant that took up a lot of time, bandwidth, resources to do all that. And really, at the end of the day, they've kind of incorporated them in small ways within the scoring of needs and benefits, but you now have two sections that you don't have to do anymore completely. So that's great. Now, over on the required but not scored first column, executive summary, as usual, financial information and sustainability, statement of experience. Those two are super easy. You do not want to spend much time on those. The technology system plan is a little bit more detailed. It will scare most grant writers when they read that section and they hear all the technical terms and network information needed. It's not nearly as scary as it sounds, okay? So if you get to that point, you need help, just give us a call. We'll help demystify it and help you understand the basics of what needs to go in there. Then in the required but not scored section, we've got the official grant budget, match letter and worksheet, certifications and assurances, proof of legal existence and eligibility, and the state rural development letter. So that's pretty much all the major components. And there's a lot of supporting information that we recommend you put in, you know, as far as like the match letters, community support letters, budget from the recent year, resumes of key individuals. So there's a lot of good supporting data, but this is in a snapshot, everything that goes into the grant. So circling back on project design, because again, for us, this is very important. This is where the rubber meets the road. This is what's going to make the project successful upon implementation as well. Before you can begin constructing your project, you do need to first articulate what it's about. And this is from the grant writing perspective when you're actually writing this grant. Is it distance learning? Is it telemedicine? Or a combination of both? Now, if you're teaching on healthcare related issues, it's really still considered just distance learning. Whether it's CME, you know, a training of some sort, whether you're working with a nursing program that's training your folks or doing preceptors over video or something like that, you know, that would be something more along the lines of distance learning. But and I won't say that there's any preference given to combination projects or distance learning or telemedicine. I think they just fund the best projects each year. But I will say that telemedicine has come on strong. This grant used to fund a lot more distance learning, and we're seeing a lot more healthcare, you know, getting some of this funding now. Next up, what problems are you trying to solve through the use of its technologies? A lot of folks come to this grant and even say, we just need equipment for telehealth. Okay, well, let's define what that problem is. And if you're not sure, we like to start the process with like about a 5 to 10 question survey out to your rural sites, patients, practitioners, whomever, who can give you some good anecdotal evidence and information and feedback about what are some of the biggest needs. And we recommend you do this anyway, even if you do have a good idea, unless you have done a recent healthcare needs assessment or distance learning to identify what are the big disparities and is there anything new that should be on our radar? And everybody knows the hot buttons right now, which is opioid abuse, you know, STEM and distance learning. But beyond that, you know, what else is a problem in your area? And who is your target audience? This helps you understand who your end users might be. Some folks know they want to do telehealth, but they're not sure who to connect to. Hopefully that previous slide with all those entities gives you some idea if you're struggling with that. But, you know, knowing who your target audience is going to help you cater to them. And then back to this recurring theme of thinking on a broader scale. Expand your thinking beyond the initial focus, you know, like what Shannon was talking about earlier, having a foreign language teacher. You can do a grant just based on that, but you really want to wrap in STEM, you want to wrap in professional development, you know, for that. And as I mentioned, getting several uses of the equipment so that it is more effective and efficient for you guys, because there is a match that goes into it, and, you know, it's still money and you want to spend it wisely on this particular program. And then finally, identify potential project partners, participants that will benefit from the education or healthcare services you propose to deliver or receive. Same point I was just making there for you guys. So to get into this a little bit more, what does the typical RUS grant look like? And in most cases, it's a hub and spoke model where you have a provider in the middle or multiple providers, and they have the doctors or the trainers on their site, and they're then going to be connecting out to the rural areas, the spokes, to provide whatever services. And that's generally what a healthcare, you know, program looks like. And most of the education as well, but certainly the healthcare, there's got to be a provider of some sort. Now, you don't always have to have that provider in the grant. If they already have equipment to provide to you, for instance, let's say you're the rural recipient, then you can just write the grant for you to receive the services, get the equipment to receive the services, and still work out, you know, an agreement with that provider. So a couple different ways to go about it, but like we're working with some mental health providers in Tennessee. They have like 7 sites, and they also want to connect to 7 schools. So now we've got 14 sites that we need to, you know, include in the purview of this grant. And then sometimes they have like a hub/end user to hub/end user, which means that you have both sites have resources that the other site needs. And as long as both of those sites are rural, you know, that works too. So a comprehensive care plan, or if you're sharing specialists, you don't know where that specialist is going to be on a certain day, you know, you may need both sites to be a hub/end user. And with this grant, they do have site designations. They have a pure hub, which means send only. They have a hub/end user, which is a send and a receive. And then they have a pure end user, which is receive only. And what's important to know is that hubs, the rurality and the SAPE is not factored in. They get a free ride. This means that urban sites can participate as hubs. And then your rural sites and your hub end users, because if they have any end user capability as a hub end user, they should have a rurality score there too. So those two types of sites get scored for you. And that's what makes it up. But you can have multiple hubs. You could have, for instance, 3 hubs and 8 end users in a grant or something along those lines, just to give you ideas for, you know, what a budget might look like, what a site list might look like. So down here, we've got an example of a rural hospital to rural mental health service and substance abuse clinic. Hospital connects to the MHSA clinic for services not available locally, and the clinic connects to hospital for continuing medical education and training. Okay, so what we've been talking about is really identifying if this is the right grant for you, okay, and what to do next. Okay, now if you've decided that you want to explore this further, the next step is scoring a site list. Everything around this grant revolves around the site list and the budget. So once you know your essential focus, you really need to pull your sites together, and you want site names plus physical address, not PO boxes, not mailing address, where they're physically located, where the equipment's going to be installed. That's of utmost importance. And then we have what's called an objective scoring calculator, which is kind of our in-house LDA tool that we use for the DLT grant. They have their own set of worksheets in which this data can transfer to those worksheets. But as just a general, you know, getting your project aligned standpoint, this is a good tool that you guys can use to plot all the sites, and you may have to make some tough calls on some sites that may need to be excluded for scoring purposes. I think Shannon and I are very good at helping people through that process of getting pre-qualified there. Then you list the sites, you put the hubs up top because this is an Excel file and you do not want to average in their rurality scores. Then you put hub end users, then end users in any order. Then you find their rurality, which we're not going to go into very deep today. That's really something we do during our workshop and can take a lot of time, but we can help out a lot. If you want to just send a site list, Shannon and I can respond with some scores. So we will help you find your rurality, which is based on 2010 census population of the town and the physical address location. So not the county, but the town where they're physically located. And then you look up their poverty economic need percentage, SAPE, which is on one website, very easy to find. I'm so glad they changed to this because they used to use NSLP. And that was hard just to get that data when you were working with schools. If you were doing pure healthcare, it was a nightmare. So now you go to one website, grab the county level data and move on. It's so much easier. Then you crunch the numbers, find out is your score competitive, look at the site designations, identify how you want the flow of services to work, you know, within your project. And we can kind of help you strategize with that. It's kind of the fun part for us, you know, to help people figure out the best way to go about, you know, applying for this grant. And then if not, consider adding or deleting sites to obtain a higher objective score. So this is a snapshot of the rurality scoring. And you can see the table over here with the tiers based on town population, right? So anything under 5,000 gets a maximum score of 40. Anything over 20,000 gets a score of 0. Now you can include them, but you don't want many zeros because that brings your score down a lot and can actually bring you down below 20, depending on what your site list looks like. So just, you know, keep that in mind. All rurality, you want to put all the rurality scores in there, even for the hubs, just to track it, but don't average them in. And also, if a site is located outside the city limits of their physical address, and there's a way to check this on the census website, then they may very well end up getting the maximum rurality score. So anytime I'm doing a site list evaluation and scoring for someone, anytime their population is really over 5,000, even if they're in a 30-point territory, I'll still look up their address because there's potential for that 30 to become a 40 or that 20 to become a 40. Certainly we don't want any zeros. We want zeros to turn to 40s. But you know, there's a way to figure that out and get max rurality scoring. Okay, I'm going to continue on to economic need, and then I'm going to stop and see if there's any relevant questions so far. But this is a link to the SAPE, but if you just also Google search SAPE, it'll get you to the right interactive tool. And this is a snapshot of what that website looks like. And what you basically do is you put in your state, then you fill out the counties that you want to look at. By clicking the box, a pop-up box comes up when you click on the county, and you click on a state. And then you'll find the percent in poverty, and you may have to scroll over when you first get on this page, okay? But the percent in poverty will show, that's the number that you want to track, the 32.4. You always want to have that one decimal point, tracking over onto the SAFE worksheet. Okay, so we'll move on to special consideration at this point. Now that we've talked about the two demographic scores that you can affect, special consideration, again, generally 10 points, all points are golden. So even in a year where we feel like points don't matter, you still want to go for them if you can. Now, if your project is just completely different, for instance, I was working with a radiology program last year, the points were only for opioid abuse. There was no angle to work there. So we just avoided those points and went on, and that was fine. But if you have an angle to work, what you want to do is put your focus on the early stage of that narrative section, focusing on whatever those points are awarded to, whether it's opioid abuse. This year we're hearing that it may just broaden to substance abuse in general, not just opioid abuse, but substance abuse. Whatever it is, vie for those points. All that we know is that projects should have a predominant focus on these areas, meaning at least 50% of the utilization of the equipment is for that. They don't ask you to state that, and they don't really have a scale for it of any sort. You just have to make it the predominant focus in your application, we think. Very broad, but at this point, there was very, very broad definitions of opioid and STEM. Opioid abuse treatment could have been public education programs, and that's it. Or just talking with patients when they came in about their prescriptions and stuff. But it would also fund medication assisted treatment programs, or delivering into halfway houses. So it was really broad, and STEM was also very broad to include things like nursing education. I think CME qualifies as STEM because you're in the health sciences, industry is the way that Russ put it to us. So we're enthused by that. And again, whatever it ends up being, just take a long look at it to see if you can vie for those points. It's very easy. Last few applications, they really have only had a small section dedicated to this, and then a worksheet. They didn't really ask you to jump through a lot of hoops. That may change in the coming years, but it was really just making it a predominant focus. And I should have populated these, but this gives you some idea of all the different things under STEM that qualifies and under opioid. And you guys will get a copy of these slides too, so I'll just continue on. See how we're doing on timing? Okay, we're about 11 after. So when it comes to workflowing this grant, I think this is one of the biggest benefits of working with our team, is that we've done this grant so many times that we know how to workflow it properly. Most folks would pick this up and start A through L and go that route. And you're just going to end up doing a lot of changes and reworking, and also at the last minute, you're going to be up against the deadline, because some of the stuff at the end is what you need to do first. Okay, so working with us will help you understand the order in which to do the project, so that you end up with an eligible grant that meets all the criteria, that is as Loctite as possible in terms of all the technicalities that we've seen people get thrown out on, and making sure that you're spending your time wisely. Again, I've seen people come to me with like a statement of experience draft that was 20 pages long, and that only needs to be about 2 pages. Even though that's not what you read. You don't read that in the guidelines. It's not anywhere in the guidelines. But we know from experience that you just need to do a minimum amount on that and financial information and sustainability, and spend most of your time writing in the needs section, and then with a secondary focus in section H, telecommunication systems plan. And we know, we help you understand what to put in and what not to put in. So again, we kind of say switch things up. This is the order that we really kind of recommend people go in. You start with the paperwork first, the worksheets, you know, subjective section after that. Then you get into the technology considerations, and then the unscored but required sections. Now, at the very beginning, I still recommend that once you got your site list worked out, you're going to need a quote from a vendor. When you read the grant guidelines, some things are going to stick out. Mainly, there's a section there that says that vendors can no longer pay for grant writing support, and they can no longer write a grant for you, which is something that vendors have been allowed to do in the past. Frankly, someone did some fraudulent stuff, nothing related to our program or folks that we work with, and they ruined the party for everyone. So they now changed that to reflect that. But you can still, but because this is an equipment only grant, you're going to have to work with vendors to get equipment pricing, and your budget really needs to be supported by a quote, broken down by site, line item by line item. And when you get to your telecom plan, you have to discuss, you know, what's in your budget. So the quote's very important, and you do want to get the technology options figured out pretty early in the process as well. So we recommend not waiting until the end to do that. And again, when you start the process, the first thing we would recommend once you're like, okay, we are green lighting this, we've got our sites, we've got our project design, you know, we know what we're going to go after, check your SAM registration and grants.gov. If you have it all in place, that's great, but you want to check expiration date for SAM and make sure it's set up right. Whoever's writing the grant for you needs to be set up as the AOR in grants.gov, and you want to go in and start the application in Workspace just to make sure you can get in and get everything rolling before you start writing. And those with grant writing experience are all shaking their head right now. Yes, yes. Those who don't or don't know what SAM and grants.gov are, you probably have somebody that handles grants for your organization or in the legal office or at least your CEO or exec director that can tell you whether you guys have it. If you're unsure, it starts with the DUNS number. You can send me your DUNS number and I can check for you to see if you have an active SAM registration. But if not, doing both of these takes usually about 2 weeks to get set up in both programs. So you want to start that early in case you run into any, you know, hiccups. And without fail, I mean, there's several steps to ensure that you're ready to go. We've thought we've been there before and went to the process to submit and found out that, for instance, like an eBiz point of contact had left the company and we didn't have an existing password that we needed, and it was pandemonium. And we've even had to switch out fiscal agents at the last minute because of SAM and grants.gov issues. Now, if you're the only one working on this and you don't have another potential partner to just take the lead like we do in some grants, you're stuck, you know? So just, you've got to get that done way before the deadline. Okay, moving on to the heart of the application, the needs and benefits only scored section of the grant worth up to 30 points. This is where you want to pour your heart out about all the bad things in the area. You know, bad equals good when writing grants, 100%. And this section is the big differentiator. You know, if you're neck and neck with people in points on the demographic scoring, then this is where, you know, decisions will get made if it comes to scoring, you know. And we have created sort of a template to guide you guys through this section. We could talk to you about how to use that and provide it to you. It's kind of the prompts in order of the application, so you can just start writing on there. And also some of our own thoughts on, you know, what reviewers are looking for that may not be so clear when reading the guidelines. But essentially, you want to be a storyteller with this grant. They're not looking for technical writing. They don't want an IT guy writing this grant, for instance, unless they're, you know, just have a more relaxed style of writing. This is where you can really demonstrate the need for the project and resonate with the reviewer. So without going into, I don't know if we have another slide that goes into really great detail. I do want to spend some time. When we do the grant writing workshop, we spend about an hour and a half on this section. And we have everybody write their own summary at the end of the section just to kind of get a feel for what it's going to take. But what you generally want to come out of with this section is about 3 to 6 bullet points of established community needs, like the need for opioid abuse, you know, disorder treatment, the need for CME, you know, the need for mental health services into this specific area. Whatever those needs are, that's what frames your project. And then you derive benefits and outcomes from those. Now, don't be afraid of the outcomes, because this grant isn't an outcomes-based grant, but they do want you to try and quantify, what you think you'll be able to accomplish. So having a well thought out needs, benefits, outcome argument is the way that you want to organize your needs and benefits discussion after you do the community profile and everything that's required early in the section. Now, if you're really needing some information to write about and you feel you're kind of short on data, doing community involvement and needs assessment is the place to start. And this grant loves to see community involvement. So at the very least, it's good to have things like a survey. It's good to have things like community support letters from individuals that are speaking from the heart, and they're not just signing a template that says, yes, we support this project, and it's the same as everybody else's letter. One thing we recommend early on is having a planning meeting or putting a committee together for this grant or for telehealth, however you want to label it, and have key stakeholders involved very early in the process. When you get a group of people together in one room and it's technical, programmatic, clinical, outreach, the conversation erupts in a good way, okay? Everybody has some input. If you ask a question, if you're only talking with one person, the chances, when I go through an exploratory conversation with that person, of them knowing all the questions that I'm asking is very low. But when you have 3 or 4 or 5 people on the call at the early stages, then you can put together a comprehensive plan. Then you can assign lead roles and action items, and not everybody has to be involved the whole time. But this grant wants you to actually write into the application what your community involvement has entailed. And if you can say that we've got this committee, these are the folks, these are the individuals that are part of it, this is who they work for, this is why they're important, they know that you're not doing this grant in a silo in a back room on your own. And that's important to them. So these are the things that we recommend: Survey Monkeys, climate assessment, other data points like test scores, health or economic data. If you're a writer and you have your favorite sources of data, that's great. If you need favorite sources of data, we can help point you to them, just for some basic data. But nothing is better than getting real-time feedback, from the rural community members about what they could use in addition to what you guys are currently providing. Okay, and then assessment leads to needs identification and project design. So when identifying your needs, again, try to think broadly, start with this primary need, and then consider other ways that this equipment can help address problems in your area. For example, we have a primary need to provide primary care in a school-based healthcare setting. So some other needs and use cases that can come off of that are prevention and wellness programming, special education services for whether it's PT, OT, speech, anything along those lines, expanding access to teachers, families, community members, and so on. Brainstorming with the group and brainstorming with folks that are very passionate and visionaries. This is a good time to get those people talking within the organization to kind of surface all of their ideas and what they've heard from folks and what they see as big issues in your area. It's funny because I do this a lot. Having all these different roles within an organization together working is perfect, because if you try to write a grant with just a visionary, it's very difficult, right? It's all in the sky stuff. You need somebody on the ground that can actually, identify how we can make it work. So you need those kind of role players in the application process too, or it helps, at least in my opinion. How does your project address those needs? That's the next question that you want to address, and you want to describe your project, and you want to do this pretty early in the process too, because you do have to send a letter to your USDA state director that has a project summary, and it can be basically what you see here, but in a little bit more detail. You want to describe your project, and answer the question, how do the technologies you're proposing help address those needs? So for instance, this project places telemedicine endpoints along with digitally connected medical scopes in each of our schools. This will allow real-time connections to healthcare experts for the delivery of primary care, addressing the critical lack of access to geographically accessible healthcare. So if anybody asks, what are you guys trying to do with their project? There it is, so that everybody understands, especially if you're engaging rural participants and you need to tell them a little about the project, but also as you start to framework your project and send the letter to the USDA state director, getting your project idea well-defined early on is a pretty big need. And then when you get to the budget worksheet, we're going to switch gears here from the needs section. I think we've spent enough time on that, but just for today. But the budget worksheet is the next important item to kind of review. And we wanted to give you an example of what it looks like. You have to do it site by site and line by line. And you copy the same site order that you started with on your objective score sheet, with hubs up top, end users at the bottom. It has to be in the same order as all of your other site lists. But this shows, for instance, an education mobile cart for 10,000, 2 units, 20,000. This shows grant or match funds in one column. We do have in-kind listed out here just for example, but just do not try and leverage in-kind. Because first of all, in-kind is not what you think it is. If you go back to the first thing I said, never assume anything with this grant. In-kind is one of the biggest examples. Their definition is unlike any other thing. And it basically boils down to just being cash match. It has to be equipment that's fundable by the grant, that's purchased with non-federal funds after the grant application due date. It's basically cash match. It's not soft cost. It's not anything that's happened just previously to doing the grant or any costs related with developing the grant or bandwidth or personnel. None of that qualifies. So you just should call it cash match. And there's a couple reasons for that. I won't go into the weeds on that today, but it can have a very specific impact on your grant being kicked out of the review process because they lower your match. Just take it from me, stick with non-federal cash match contributions. Don't try to wrap in any kind of in-kind at all. But at the bottom here, I'll get off my soapbox on that. This shows an overall DLT project budget of $85,000. Okay, and let's just pretend this is all cash match for $11,100. Now you take the cash match out of the project budget, giving your DLT grant request a total of $73,900. It's the $11,100 match divided by the DLT grant request of $74,000-ish that gives you the 15%. You do not apply it to the total project budget of $85,000. That's the wrong calculation. It actually ends up being about 13% of the total project budget. But if you do it the other way, then you'll end up matching a little bit more than you need to. So just bear that in mind. But I will say it's better to match a little bit more than a little bit less, because we'll get kicked out if that's the case. Now you heard me talk about the Telecom Plan earlier, and we do want to put a plug in here for the budget narrative. When in the Telecom Plan, this is where you have to describe the items in the budget, and this is the make or break moment between whether reviewers decide an piece of equipment is going to stay in the grant or not. And if they decide a piece of equipment is going to get whacked, they'll just redline it and they'll keep going, and they could end up funding the rest of your grant, but it'll have an impact, on your budget. So this just shows an example of the telecom, equipment description for the budget that we looked at on the previous page. And they want you to address what is it, what's it do, and what percentage of the time are you going to use it for eligible DLT activities. In most cases, it's always going to be 100% of the time. But sometimes folks wrap in administrative use or just meetings, or something that's just not going to qualify, and they'll reduce that percentage to be sure. But as long as it's over 50%, then the full amount of funding can be considered. Shannon, I'll pause real quickly. Are there any relevant questions on the needs or budget that have come up so far?
Yes, Casey. And one of the questions is related to the points in terms of opportunity zones. The question is, will there be any points awarded for projects in opportunity zones?
In like enterprise zones and empowerment communities, that sort of thing?
The question is from David. So David, I don't know if you want to unmute and elaborate.
Because that would, if it's the old grant, like the empowerment zones, enterprise community, even the champion zones for those aren't a priority points for them anymore. Promise zone was another one. Then they moved on to strike force counties at one point. So they have changed that priority category a lot over the years. And as it stands today, there are no points for that anymore. It just is for, the project focus. Now, if you're in those zones, we still recommend highlighting it, because at one point they were USDA hot buttons, and they should probably still, raise a good flag for them when they see them. So we recommend talking about the fact if you're in a strike force county or empowerment zone or something like that. I hope that answers your question, David.
Another budget matching funds question comes from Kathy. The question is, I'm located in rural Alaska at a training center owned and operated by a state agency.
Okay.
We are a sub-recipient of several federal grants and about to get get about a third of funds directly from the state. What would be an appropriate source of matching funds?
Just anything that's non-federal in origin. State funding absolutely can be leveraged, towards this grant. Now, if you're all federally funded, you may even have to look to sort of project partners, or I've seen people go out and secure through industry partners, at least parts of their match. It still becomes an issue with like nonprofits and completely federally funded organizations, but we have found that they're able to cobble together the match, either through various sources or they find it in their budget. But state agencies, they are, as I mentioned, eligible. I find that they're in that situation quite a bit. But hopefully the fact that state funds can be utilized is good and works for you.
Okay, and we have, let's see, here's one more question. If you received funding in a prior grant cycle, are you eligible again?
Absolutely. And I'm not sure if I'm going to cover this yet. So this grant loves repeat awardees. Now, they do have some things so that they're not funding the same projects over and over again in the same area. It is called non-duplication of services. And there's about 3 or 4 different layers to that. But to your question, if you have been funded or any of your sites have been funded for DLT in the last 3 fiscal years, you can still be awarded. You just have to identify what that project was for and show that it was different from what you're doing now. And then if you're beyond 3 fiscal years, you don't have to really identify that you've been, DLT funded in the past. And a lot of folks have come to this grant, gotten funded for equipment, come back 3 to 5 years later, did a total refresh, came back 3 to 5 years later, did a total refresh. So they're continuing to come back to this for updated technology. So if you have old technology, that counts as a reason for why you need it, because especially if you're using it well, if it dies on you and it's like an end of life unit or you don't have any backup, then that's a mission, it's a critical problem, for you guys. So this grant's very, sympathetic to, aging technology and getting it replaced. But again, last 3 fiscal years, you have to identify if you've been in a DLT grant. Also, as you're applying this year, you just want to make sure that none of your sites are a part of another current, DLT FY20 application that's being written at the same time. And I say you want to make sure they're not in there. They actually can be funded in both grants, but you have to note that they're a part of these 2 projects, and you have to, include the executive summary and just show that they're different. So one maybe for pure distance learning, one's pure telehealth. They should be competitive in both grants and able to get that funding. But you do have to identify that up front for them. Otherwise, I haven't seen this happen before because I haven't really run across it. I think they may take one site out of one of the grants and just fund them for one because it wasn't identified. Okay, any others before I move on, Shannon?
There is one question about hub sites and the scoring, and I'll go ahead and I can answer that.
Sure.
The chat. And then at the end, if we want to talk about that more, we can. But let's see, that question's from David. So David, I'll go ahead and answer that question for you in the chat. And then know that Casey and I are always there as a resource too, as far as any of the questions go, as far as scoring, budget, et cetera. Any of these components, feel free to reach out to us afterwards as well, and we can help with a lot of those templates. So thank
awesome.
you.
Thank you, Shannon. So putting it all together, there's a DLT checklist, to help organize everything, which actually has to be printed and signed and included in the application that has all the elements. We recommend for each section that you create a header page, a footer page that lists the applicant name, the section, so a big A at the beginning and a big B and C and all that. So the reviewer knows where they're at in the application if they're looking at it as a single file. Now you want to PDF each section separately and put it into the SF424, which is the electronic online SF424. If you're looking for the SF424 and you can't find it on the RUST website, that's because it is embedded as the application on grants.gov. So you go there, you fill out that online SF424, and then you attach your PDFs, all the individual A through L's, or really B through L, because A is the SF424, into box 15. And that's pretty much it. I mean, as far as, putting it together, we also recommend, as far as pre-submission tips, another plug for the SAM registration date. If everything was good, but you're going into the review process and the deadline is a couple weeks out, you want to go ahead and change the SAM password now, because if it's expired by the time that they start looking at your grant and you guys don't catch that, that's another reason why they might kick your grant out. Okay, so also make sure that budget numbers on your SF424 match exactly with all the other areas where your budget numbers come up, like executive summary, match worksheet, match letter, budget worksheet. This is why our workflow, I think, is so important, because if you do things out of order and you have to change things, you have to go back and change it in so many places. If you have to change a site order, you have to change that in like 4 or 5 different places. It can be a lot more cumbersome than it needs to be. So look for the big show stoppers, and if you're working with Shannon and I, we make this a routine working with folks that before we go online to submit, we spend about an hour, 2 hours on a desktop sharing session and going through every single file again. Now, chances are we've already been looking at them 100 times, each one, but it's still just good before you get ready to go, because you have so many versions of different documents, to make sure you're attaching the right thing and just do a final once over, because it hurts when your grant gets thrown out over a technicality. If they're going to do that at all this year. So things like, are your match letters on letterhead with a signature block and the signature of someone with fiscal authority? All of those things matter. If there's not that, all of that stuff, they can kick the grant out just based on the match letter alone. Are the narrative sections complete, and are they the most updated versions? Are all the site tables consistent with the site morality worksheet? So if you use tables in other parts of this grant, and there is a lot of redundancy, by the way. So if it feels like you're repeating yourself in a lot of areas, just copy and paste and you're going along with the correct flow of this grant. Is your budget behind the scope of work? Do you have a geographic map and vendor quotes included in the Telecom Plan? A lot of little gotchas. Basically just have an extra set of eyes ready to review. Do not just work on this on your own and then submit it. Have someone look at it, as well as with the needs section. Once you have crafted that, our team is also glad to provide feedback on, not like, okay, you missed a comma, or, not grammatical feedback necessarily, but really substantive feedback on what types of arguments to be making, what type of data to include, and even some stuff to exclude if we think it's not really good to put that into your grant for certain reasons. So we'll give you that kind of substantive feedback and take a few days, to review it and give you good feedback. So this actually marks the end of the slides. We're a little bit finishing early. I wanted to give us about 15 minutes, so we've got a little bit more time than that for any discussion as well. Here is contact information for myself, Casey Rossetti, and Shannon Schaefer. If you're in Indiana and Iowa, contact me with any questions. If you're in Ohio or Kentucky, please reach out to Shannon. And we can discuss, how we support, folks, and the way those things work. And again, really try to help you guys to empower your organization to go after this grant, feel that it's well within your ability, and know that the time spent working with us and avoiding technicalities is very likely going to pay off, okay? It's very likely going to be awarded based on the amount of funding. I'm not going to guarantee it, but just super high chances of success. With that said, I'll just pause, and Shannon, if you see some more questions, or if you have anything you would like to add, that I may have forgotten, as we went through this in your mind, feel free to throw in any additional information about the grant or how we can help, and then any questions that seem good.
Okay. Let's see, it looks like so far I don't think we have any new questions. Something I always like to throw out is, I know sometimes it's just like where to start that's the most difficult step, right? And so I like to tell people too, if you have an idea of the project, if you want to share with us the sites that you're interested in including, we're more than happy to go ahead and score those sites with you, and then maybe have that conversation about what makes sense in terms of, is this going to be a competitive application? And again, thinking through, giving ideas for what the budget would look like, et cetera. And so oftentimes if you just get those initial sites nailed down, the rest of the pieces will start to fall into place. So then you can determine, what partners you would need to work with, what individuals from those organizations or within your own organization need to be in on those conversations early on. And so when the grant does come out, there's typically a 60-day turnaround time. So if you have those key pieces in place, I think it makes for a much smoother process. And it's never too early to start that. You can start that today.
Absolutely. We're all hoping the grant delays another month. Yeah. Like that, just to give people more time. And it could happen. We really don't know. It could push out 2 months. We've seen Russ say it's coming for a couple of months, and it just took forever, and it finally came out. So if you feel like, oh, we just don't have time right now to meet the deadline, if it's going to come out soon, still explore the opportunity now for a couple of reasons. One, this grant will be back again in FY21. So if you don't make it in time for now, you'll at least have broken ground on the idea. And there's also plenty of other, types of funding out there through HRSA and, other funding streams that we work on outside of DLT. So if we can't make it for this, there's another grant that usually comes out right at the end of RUS that may make a fit for what you're doing, or a number of grants for that matter, depending on what region, you guys are in. So we really hope that today's session has been informative and helpful. We'd love to see you guys, go back and contact us with questions and see if we can help you put a team together to go after this funding and try to get as much of this into this region, as possible, over the next couple of years. Sorry.
We have 2 questions. One, is there a fee to work with us?
So we can kind of go over that on a case by case basis, but essentially, for today's purposes, we just want to deliver content for free, and help everybody understand that this is a good opportunity to apply. But there's no fee really associated leveraging our services under certain criteria.
Who should I call in Illinois? I can answer that within the group chat. That would be you, right, Casey?
That would be me. I also cover Illinois.
Yeah.
And maybe I got this wrong. Maybe it was supposed to be Indiana and Illinois, but anyway, I'm the person to contact there.
All the I's, all the states.
All the I's.
Casey's your man. Is using this technology and grant applicable to addressing social detriments of health? Excuse me. So I guess, Derek, that was your question. Really the technology is telemedicine and distance learning. So there are no parameters around what you're utilizing that for, if you're using it within the scope of those 2 descriptions.
I would think there's a play for that. Can you, if you're on still, and can you give us an example or describe that? Because that's the first time I've really heard someone phrase that question before. Was that Derek, you said?
Yes.
Okay.
Can you hear me?
Yes, sir, we can. Thank you.
Yeah, addressing social determinants of health of using the technology and the telehealth capabilities for like rides, telepsychiatry, and coordinating those type of services at these sites.
Absolutely. Telepsych is probably where it all began with telemedicine. So yeah, that's very fundable. And whatever the core issue, we've seen people go after this grant for every type of healthcare focus that I know of, right? Telestroke, tele-ICU. In Arkansas, they used to have this thing called the Angels program for neonatal, antenatal, the whole gambit. You name it, if it's an issue and you're delivering a service to help to address that healthcare disparity, it's fundable. I mean, I haven't run into anything yet that we've seen it's not. And I'll say it again, you know, I thought a few years ago that prisons wouldn't really look at them as a great, like they want to fund projects into prisons, but we have seen them doing that more and more now. And more people wanting to deliver that service into state prisons or county jails or wherever, you know, that service is needed.
Thank you.
You bet.
Gayla asked if there was a place that posts successful grant awards from previous years. And we do have that nice spreadsheet that DLT, or RUS, I should say, released from the past cycle as far as the awards. And it has a description actually of each project. So I think that's a great tool to get an idea of what's out there.
It is. And we can email that to you, or you can just find it on the RUS grant homepage. You have to go to, I think, forms or something. And then there's a list of years, hyperlinks for each year, and you can click on that and get the full awards list. But we also have it on our computers because we're RUS grant nerds. All right. And any other questions that we see so far?
No.
All right.
Well, I want to thank you, Casey and Shannon, so much. This has been very informative. There's a lot of details in this particular grant. I appreciate you coming on. As I mentioned at the beginning, we did record today's session, so we will post it on our UMTRC YouTube page, and we'll send the slides out to everyone that registered. I did, in the chat, post a quick survey, just 7 questions, and we certainly appreciate your feedback about the content of our webinar series.
And thank you, Becky, for the opportunity to deliver this, you know, via the RC, and appreciate y'all's support. And hopefully, you know, we continue to do this in future years and help deliver information and support as needed.
Absolutely. Thank you all so much.
Thank you.
Thank you.